Imagine this. You're ready to start your journey to motherhood. You've been dreaming about it, planning for it, maybe even baby name shopping. But here's the question. Have you given your body the right fuel to prepare for the incredible journey of pregnancy? The truth is, pregnancy doesn't just begin the moment you conceive. It begins with how well you've nourished and prepared your body before conception. And one of the most important ways to do that is through vitamins and supplements. Research shows that the weeks leading up to conception and the first few weeks of pregnancy, when you may not even know you're pregnant yet, are some of the most critical for your baby's development. So getting your nutrient levels right beforehand can make a world of difference. Today, we're diving into the top vitamins and supplements every woman needs before pregnancy. Stick with me until the end, because I'll also share tips on how to choose the right prenatal supplement and avoid common mistakes that many women make. Let's start with the #1 superstar, folic acid. If you've ever read anything about pre-pregnancy nutrition, this one always comes up, and for good reason. Folic acid, or folate in its natural form, is essential for preventing neural tube defects, which affect the brain and spinal cord. These defects occur in the very early weeks of pregnancy, often before a woman even knows she's pregnant. That's why doctors recommend starting folic acid at least 3 months before conception. The recommended dose is about 400 to 800 micrograms daily. You can get folate naturally from leafy greens, beans, and citrus fruits, but supplementation is key because diet alone often isn't enough. Next, we have iron. During pregnancy, your blood volume increases dramatically, and iron is needed to make healthy red blood cells. If your iron stores are low before pregnancy, you're at risk of developing anemia once you're pregnant, which can cause fatigue, complications, and even affect your baby's growth. Iron supplements or iron-rich foods like spinach, beans, and lean red meat help build up your stores. And here's a tip. Taking vitamin C alongside iron boosts absorption, so pair that spinach salad with some lemon juice or oranges. Moving on, let's talk about vitamin D. This one is huge, yet so many women are deficient in it without even realizing it. Vitamin D plays a critical role in bone health for both mom and baby. It also supports the immune system and may even improve fertility. If you don't get enough sunlight exposure, which many of us don't, you'll likely need a supplement. Most doctors recommend about 600 to 1,000 IU daily before and during pregnancy, but it's always smart to get your levels tested and follow your doctor's advice. Another important one is calcium. Your baby's bones and teeth will rely on your calcium stores, so you need to make sure you're building a strong foundation before pregnancy. If your calcium intake is low, your body will actually pull calcium from your bones to give to the baby, putting you at risk for bone loss later in life. Dairy products, fortified plant milks, leafy greens, and almonds are great sources, but supplementation may be needed if you're not meeting the recommended 1,000 milligrams per day. Now let's highlight iodine. This is one most people don't think about, but iodine is essential for healthy thyroid function, and your thyroid plays a direct role in fertility and pregnancy. Deficiency can lead to problems with brain development in the baby. You can get iodine from iodized salt, dairy, and seafood, but many women still fall short. That's why most prenatal vitamins now include iodine, usually around 150 micrograms. Next, vitamin B12. If you're vegetarian or vegan, this one is non-negotiable. B12 is essential for red blood cell production and nervous system health. Low B12 can also lead to infertility and increase the risk of complications. Animal products are the main source of B12, so if you're plant-based, you'll definitely need a supplement. Now let's talk about omega-3 fatty acids, specifically DHA and EPA, which are crucial for your baby's brain and eye development. Omega-3s also reduce inflammation and may improve fertility by supporting healthy ovulation. You can get them from fatty fish like salmon and sardines, but if you're not a big fish eater, or if you're concerned about mercury exposure, an omega-3 supplement, especially one that contains DHA, is a great option. Plant-based women can go for algae-based omega-3 supplements. Another key nutrient is zinc. This mineral is important for cell division and ovulation. Zinc deficiency can affect both fertility and pregnancy outcomes. Foods like pumpkin seeds, beans, nuts, and whole grains are good sources, but supplementation ensures you're consistently getting enough. We also need to mention vitamin C. Not only does it help with iron absorption, but it's also a powerful antioxidant that protects both eggs and sperm from oxidative stress. Fertility specialists often recommend boosting antioxidant intake when trying to conceive, and vitamin C-rich foods like oranges, strawberries, and bell peppers are excellent additions to your diet. And here's one more that often goes under the radar: choline. Choline supports brain and spinal cord development, much like folate, but it's not always included in standard prenatal vitamins. Eggs are one of the best dietary sources, but supplementation can help if your diet falls short. Now, let's talk about how to choose the right prenatal supplement. With so many brands on the market, it can feel overwhelming. A good prenatal should include folic acid, iron, vitamin D, calcium, iodine, and B12 at minimum. Some also add DHA, which is a bonus. Always check the label, and don't just grab the cheapest bottle on the shelf. Quality matters because you want to make sure your body is actually absorbing these nutrients. If you're unsure, ask your doctor or a pharmacist for guidance. Here are a few common mistakes to avoid. First, waiting until you're pregnant to start supplements. Remember, by the time you see that positive test, those first critical weeks have already passed. Second, taking too much of certain vitamins. More isn't always better. For example, excess vitamin A in supplement form can actually be harmful during pregnancy. Always stick to the recommended dosages. Third, forgetting that food matters too. Supplements are meant to fill gaps, not replace a healthy diet. So to recap, the top vitamins and supplements you need before pregnancy are folic acid, iron, vitamin D, calcium iodine, vitamin B12, omega-3s, zinc, vitamin C, and choline. Together, these nutrients not only boost your fertility, but also prepare your body for a healthy pregnancy and give your baby the best start in life. Now, I'd love to hear from you. Are you already taking a prenatal vitamin, or is there a nutrient you think you need to start focusing on? Share your thoughts in the comments below. And if you found this video helpful, don't forget to hit that like button, subscribe to the channel, and share this video with someone who's planning to start their pregnancy journey. The more we share this knowledge, the more women can feel empowered and prepared for motherhood. Thank you so much for watching, and I'll see you in the next video.